بسم الله الرحمن الرحيم والصلاة والسلام على سيد رسول الله لكل المرسلين. كل سنة وحضراتكم بخير. مؤتمر 17 لليودا في الأقصر. طبعا شاكر دعوتي لإلقاء المحاضرة والاشتراك معاها، بس يعني الاعتذار وارد لأن ظروف الطيران بس لا سمحت إن أنا أكون موجود عند حضراتكم. فهي يعني إن شاء الله بإذن الله هقولها إن شاء الله بإذن الله اونلاين. شكرا للدكتور عادل بيه، شكرا للدكتور خالد بيه، شكرا للدكتور مصباح، شكرا للدكتور مشاحيت. This is 17 Conference of Diabetes of UEDA, member of International Diabetes Federation. وكلفوني الدكتور خالد كلفني بيه جزء خاص بالدايابيتس ريميشن. الجزء الخاص بالدايابيتس ريميشن برضو لا اخفي عليكم، طبعا استعنت طبعا بحاجات كثيره جدا، ومنها اختي طبعا الاستاذه الدكتوره حنان السطوحي ان انا احتجت فيها، لان البلان كانت بتاعت المحاضره كثيره جدا والافكار بتاعتها وارده. هو كلمه ريميشن انا يعني بالعربي يعني هدأه، يعني او بيسموه انسحاب، او بالبلدي كده زي ما هم بيقولوا في الريميشن اختفاء، بس هو اختفاء لهدنه لوقت مؤقت. But in English, remission means that maintaining blood glucose levels below the diabetes range without needing glucose-lowering medication. Different criteria have been used in the research and the clinical practice. Also, different organizations have developed slightly different criteria, including ADA and direct trial. Direct trial هي diabetes, the remission clinical trial. Also, American Diabetes Association definition في 29 قالت ان الريميشن ده في partial remission، في complete remission، في prolonged remission. partial remission قال ان الهيموجلوبين A1C هيبقى below 6.6% والفاستنج هيبقى ما بين 100 ل 124 sustained over at least a year without any diabetes medication. طيب الكومبليت ريميشن، الكومبليت ريميشن ذا سيم، بس قللوا هيموجلوبين A1C خلوه 6، يبقى هيموجلوبين A1C بلو 6 دي واحد، وقالوا ان الفاستنج بتاعه هيبقى بلو 100 and this sustained over at least a year without any diabetes medication. Also, prolonged remission means that complete remission of at least 5 years duration without diabetes medication. Direct definitions قالت ان remission was defined as having hemoglobin A1C of less than 6.6% at 1 year with at least 2 months without any type diabetes medication. طيب الصورة في natural history is from the left to right. This is the natural history of diabetes occurring from the pre-diabetes stage and diabetes and the complication. Remissions means occurring from the right to the left. Also, it's starting from the insulin resistance with hyperinsulinemia and post-parental hyperglycemia, which lead to impaired glucose tolerance, and fasting hyperglycemia, which is manifested by impaired glucose, fasting glucose, at the end of type 2 diabetes. This is by the time we must reverse this condition. How? We know that the obesity and the insulin resistance makes the beta cell overloaded and overwork. May be due to these two conditions. The beta cell dysfunction occur as a result of oxidative stress and endoplasmic reticulum stress with a formed unfolded protein and mitochondrial dysfunction and amyloid toxicity, and also inflammatory cytokines and autophagy dysfunction and glucolipotoxicity, which means that the functional beta cell mass is decreased and resulted in hyperglycemia, which in turn increase beta cell dysfunction, and this is a vicious cycle. A report in Diabetes Care, volume 44, October 2021, this consensus report as the definition and interpretation of the remission in type 2 diabetes, which is called this author's improvement in glucose level in the normal range can occur in some people living with diabetes either spontaneously or after medical intervention, and in some cases can persist after withdrawal of glucose-lowering pharmacotherapy. Also, the definition of diabetes remission slightly differ depending on who you ask. Indirect trials هم قالوا طبعا زي ما حضراتكم عارفين هم سنه ياخدوها كده 6.5 الهيموجلوبين بتاعهم وشهرين من غير ميديكيشن. Another group قالوا الريميشن ده having الهيموجلوبين A1C اقل من 5.7% the cut off of pre-diabetes و discontinuing all medication types for at least 1 year. Others برضه believe that still taking metformin هيحطوهم ولو كان ان الدايابيتس ميديكيشنز بتاعها هيفضل discontinue and lower ان الهيموجلوبين A1C هيبقى 6.5 برضه نفس الكلام. طيب when I discuss in that right, we are referring to the first definition in الهيموجلوبين A1C below 6.6% and discontinuing all diabetes medication for at least 2 months. Terminology resolution reversal cure اختلفنا بس هو remission has been chosen ده كان ما بين كل الكلينيكال ترايلز وكل البورسز قالوا resolution يعني ما عادش جاي reversal ممكن يرجع ويجي طيب افضل ما جاش طب cure ما فيش حاجه اسمها cure بس في حاجه اسمها control دي واحده لما remission has been chosen. Also, the remission diagnostic criteria is having hemoglobin A1C below 6.6%, measured at least 3 months after cessation of glucose-lowering pharmacotherapy. Also, the prior statement suggestions that a prolonged remission longer than 5 years be considered separately didn't have any objective base. We all agree for this. Remission is not a one-off event, but a process. What is the criteria of remission? Below 6.5 زي ما احنا قلنا that at the level of 3 months with continuation of anti-hyperglycemic agent. والفاكتورز اللي affecting hemoglobin A1C measurement include الفاريانت hemoglobin, different rates of glycation في chronic disease في الناس اللي عندهم autoimmune hemolytic anemia في بعض الناس اللي عندهم انيميا برضه can occur in a variety of the disease state. Fasting glucose lower than 126 milligram BCE can be used as alternative criterion for remission. Testing of 2-hour plasma glucose following 75-gram oral glucose challenges seems to be a less desirable choice, especially after bariatric surgery. Remissions has been shown to be due to normalizations of the high fat levels inside the liver and the pancreas. And the only way to achieve this is by major weight loss. There are 3 main ways that people have put their diabetes into remission, including a low carbohydrate diet, a low caloric diet, and bariatric surgery. Could we diagnose remission while using hypoglycemic drugs? الإجابة diabetes remission may be achieved by lifestyle, medical, surgical combination of these. But a diagnosis of remission can only be made after all glucose-lowering agents have been withheld for an interval that is sufficient to allow weaning of the drug's effects and to assess the effect of the absence of the drug on hemoglobin A1C value. If the drug is prescribed for other medication as metformin for polycystic ovary syndrome and sodium glucose co-transporter 2 for heart failure or GLP-1 for glucose for loss of weight, then remission cannot be diagnosed even though nearly normal glycemic levels are maintained. A clinical decision may be made to continue such a therapy without testing for another concern. What is the temporal aspects of diagnosing remission? This intervention and the temporal phase in determining revisions that include documentation of remission should include measurement of hemoglobin A1C just prior to intervention in the form of pharmacotherapy or surgery or lifestyle. The interval before testing hemoglobin A1C can really evaluate the response. Pharmacotherapy at least 3 months, surgery at least 3 months, and 3 months after cessation, and lifestyle 6 months after being that intervention, and 3 months after cessation of any therapy. The subsequent measurement of hemoglobin A1C to document a continuation of remission included pharmacotherapy not more often than every 3 months or less frequently than yearly. Well, what is the physiological consideration regarding remission? Whether by pharmacotherapy, lifestyle, or metabolic surgery, the reversal of the adverse effect of poor metabolic control on insulin secretion and action may establish a remission. Also, in contrast, when a persistent change of lifestyle leads to remission, the change in food intake and physical activity and the management of the stress and environmental factor can favorably alter the insulin secretion and the action for a long period of time. Also, what the effects of metabolic surgery are more profound and generally more sustained? Yes, structural changes in the GIT lead to a novel hormonal milieu. These include greater GLP-1 after eating, reducing appetite and food intake, and additionally alter peripheral metabolism. The establishment of glucose homeostasis by these mechanisms is typically longer lasting, and also the change of the anatomy and the physiology are essential, permanent, but the desirable effect on glycemic pattern is not so. Partial regain of weight can occur, and continued decline of beta cell capacity may contribute to raising the levels of glucose over the time. What the ongoing monitoring? Remission is a state that is not equal to stopping monitoring. Weight gain, stress from other forms of illness, and continued decline in beta cell function can all lead to recurrence of type 2 diabetes. A testing of hemoglobin A1C or another measure of glycemic control should be performed no less often than yearly. Also, ongoing attention to the maintenance of healthful lifestyle is needed, and pharmacotherapy for other conditions with agents known to promote hyperglycemia, especially glucocorticoids and certain antipsychotic agents, should be avoided. Metabolic memory or legacy effect is relevant in this setting. This term describes persisting harmful effects of the prior hypoglycemia in various tissues. Even after remission, the complication of diabetes micro or macro can still occur. Hence, people in remission from diabetes should be advised to have regular retinal screening, tests of renal function, food evaluation, and the measurement of blood pressure and weight plus hemoglobin A1C. At present, there is no longer evidence indicating that any of the usual recommended assessment for complication can safely be discontinued. Individuals who are in remission should be advised to remain under active medical observation, including regular checkups. There is another risk potentially associated with a remission. What is this? This is a worsening of the microvascular disease following a rapid reduction of glucose level after a long period of hyperglycemia, especially when poor glycemic control is present together with retinopathy. They found that rapid reduction of the glucose level should be avoided and retinal screening repeated if a rapid decline in blood glucose is observed. Also, this assertion is based mainly upon experience with worsening of retinopathy after initiation or intensification of insulin therapy, which is seen only if moderate or worse retinopathy is present at baseline. Worsening of retinopathy can occur with other intervention, although there is some evidence that this risk is less after metabolic surgery. What is the unmet needs? This consensus is an expert's opinion. It is not intended to provide a guidance regarding how or when glycemic control qualifying as the remission should be sought. It also does not aim to clarify the role of preventive pharmacotherapy after a remission is identified. Also, rather, it proposes terminology and the structure to facilitate future research and collection of information to support future clinical guidelines. The University of Michigan asking a question: is there a cure of diabetes? There is no known cure for type 2 diabetes, but it can be controlled. And in some cases, it goes into remission. Also, the National Institute of Diabetes and Digestive and Kidney Disease, NIH, describes that achieving type 2 diabetes remission through weight loss. This is an area needing research, validation, يعني تصريح بقى إن يبقى using hemoglobin A1C as a defining or as a defining measurement for the diabetes remission. And validation of the timing of glycemic measurement. What about time in range? Also, evaluation of the effects of the metformin and the other drugs after remission is established. Evaluation of non-glycemic measures during remission. Research on the duration of remission, documentation of the long-term outcome of remission, and also development of educational materials for healthcare professional and patient. Conclusions is a term used to describe a sustained metabolic improvement in type 2 to nearly normal level should be remission of the diabetes. Remission should be defined as a return of hemoglobin A1C to below 6.65% that occurs spontaneously or following an intervention, and that persists for at least 3 months in the absence of usual glucose-lowering pharmacotherapy. When hemoglobin A1C is determined to be an unreliable marker of chronic glycemic control, fasting blood glucose below 126 milligram per deciliter, or estimated hemoglobin A1C below 6.5% calculated from CGM values can be used as alternate criteria. Also, testing of hemoglobin A1C to document a remission should be performed just prior to an intervention and no sooner than 3 months after initiation of the intervention and withdrawal of any glucose-lowering pharmacotherapy. Subsequent testing to determine long-term maintenance of a remission should be done at least yearly. Thereafter, together with the testing routinely recommended for potential complications of diabetes. Research based on the terminology and the definitions outlined in the present statement is needed to determine the frequency, duration, and effect on the short and long-term medical outcomes of remissions of type 2 diabetes using available intervention. And thank you very much. I'm happy to be here with you. أتمنى طبعا كل النجاح والصحة والعافية لكل البورد وكل المؤتمر وكل أساتذتي وكل زملائي، وكل سنة وحضراتكم بخير، والسلام عليكم ورحمة الله وبركاته.